Okay, so this is our next lecture, chapter 4 in the textbook. This is looking at tissue or histology. So this chapter correlates really nicely with what we're doing in lab currently, obviously, which is a big portion of the lab, which is identifying all the tissues and understanding function and location and those types of things. So we'll go into a little more detail here with a lot of these tissues as opposed to just strictly identifying them. But you will see a nice strong correlation with what we're doing in lab here with this lecture. So, as you guys know by now, tissues are basically groups of cells. So, we've talked about the different levels that you can look at, levels of organization. You have a molecular level, a cellular level, tissue level, organ level, etc. And so we'll be looking at the tissue level, of course, which is groups of cells. So we won't be looking necessarily just at what one cell does, but rather a collection, how they work together as a collection of cells, and that is what a tissue is, right? And these tissues then form the organ, but would be the next level of organization. And of course, those organs then are grouped into the 11 organ systems we discussed last time. So, tissues then, as you guys know from lab, there are 4 tissue types: epithelial, connective, muscle, and nervous. And so we want to work through those. Each one of those will also look at membranes and some considerations with aging and injury and how they impact these tissues. Okay? So epithelial tissues, typically just cells is all that we're looking at. They cover exposed surfaces or line passageways. Connective tissues support, of course, what oftentimes what epithelial tissue is attached to. But then also they can fill spaces, support other tissues, etc. Muscle tissue, of course, contracts. There are 3 types: skeletal muscle and smooth, and they all contract, but they're all different in terms of their location and sort of their function for the body. And then finally, nervous tissue, the thing that we'll be looking at primarily is the neuron. And the neuron is what conducts an electrical impulse or an action potential from the brain or the spinal cord out to peripheral targets in the body. So we'll do epithelial tissues first. And epithelial tissues, the things we're going to be looking at, of course, are the epithelial tissues themselves, but we'll also look at glands. Glandular structures are structures that produce secretions that we'll see, and we'll look at their role as epithelial, sort of under the umbrella of epithelial tissues as well. So what are we seeing with epithelial tissues? Well, as you know, all we're really concerned about are cells, looking at just cells, not looking at other types of components like fibers or other things like that. We're looking just at cells. Is it flat? Is it square? Is it one layer, multiple layer, et cetera, et cetera. Another characteristic of epithelial tissue is that it has a free surface at the top, meaning there's nothing on top of it, always free at the top, and the bottom is always attached to something, as I said before, typically a connective tissue. So we call that polarity, right? Having an apical, which is the top surface, a basal, which is the bottom surface, and it attaches to a basement membrane, as we can see there, and that's usually in the form of a connective tissue. All right? So we have attachment. We also have avascularity. Avascularity, what does that mean exactly? Well, avascularity means A means without, vascular means vessels, right? No blood vessels. So no blood vessels in epithelial tissue. As I said before, it's just cells. Oftentimes the vessels are very close by in the connective tissue, but they're not actually in the epithelial tissue itself. So, and then regeneration is another really important concept or component, in that epithelial cells typically regenerate without problem. It's part of their main characteristic, and that's significant, right? Because not all tissues regenerate. Like nervous tissue, right? If someone has a stroke, typically that nervous tissue, depending on how severely it's been damaged, may not come back, or it may take a really long time. Or cardiac muscle tissue, right? You have a heart attack. Oftentimes that can be very damaging because the muscle tissue is not regenerating. So regeneration is very unique and important characteristic for epithelial tissues. And so here's just sort of a garden variety shot of what we'll be looking at with cells. They have all your basic features. You'll recall from, intro to biology, you have a nucleus here, which carries all the genetic material. You have mitochondria, which is a source of energy for the cell, manufacturing ATP. You can see the basement membrane and the apical surface, right, bottom and top. You have a Golgi apparatus, right? The Golgi is a cellular property that manufactures, generates secretory products essentially, and the secretory products then typically are released at the free surface. Right? So a lot of features that we'll be looking at, but that's just sort of generally what you'll see in typical cells. And again, you can also see the polarity, right? Attached at the bottom, free at the top. All right, so what are some of the general functions? Things we'll be looking at like providing protection, controlling permeability, producing secretions. These are all different types of things that we'll look at when we look at each individual cell. All right, so what we want to do then is start getting a feel for these epithelial tissues. And you can classify epithelial tissues, for the most part, as we discussed in the lab last week, based on shape or the number of layers. And for the most part, if you know the shape of the cell or the layer, that's going to give you all these different tissue types. Okay? And so you have squamous cells, which are thin and flat, cuboidal shells, which are square-shaped, and then columnar cells, which are tall, more longer rectangles almost. And then if you do one layer, which is simple, or stratified, which is more than one, right? Multiple layers of cells. And so from those, typically you're going to get all the different tissue types. And so here you can see representation of a squamous cell, right? It's nice and flat, which you can see in that image. Cuboidal looks like a box, and then columnar are rectangles, right? And then same with multiple layers, right? You have stratified, multiple layers of squamous cells, multiple layer of cube cells, shaped cells, multiple layers of columnar shaped cells. All right? And then from these classifications, for the most part, you can get all the different epithelial tissue types. Simple squamous, stratified squamous, simple cuboidal, stratified cuboidal, simple columnar, stratified columnar. And then there are two that really sort of don't really fit into that categorization exactly. We call those pseudostratified ciliated columnar epithelium and then transitional. They're a little bit different. Same concept, just a little bit different. And we'll talk about those as well. All right? So what we want to do then is just run through these. Again, I know we've been over this in lab, so we want to take a look at these and get a feel for these different tissue types. Or epithelial tissue types. First one, simple squamous, right? One layer of flat cells. And so the features of something that's one layer and the cells are very flat should speak to you that this is a pretty thin type of tissue. And so one of the things it does is just to reduce friction, right? It'll have typically has if it's such a thin layer, small layer, has a fluid across the top. And oftentimes these simple squamous epithelium is made of membranes, like membranes lining our body cavities that we talked about last time. And so it allows for these things to move very easily across their surfaces, but also performs absorption and secretion. Great example of where you find simple squamous epithelium is respiratory exchange surface of the lungs, which should make sense to you because, where this oxygen is being exchanged, essentially, deep in our lungs at what are called the alveoli, you'd want something very thin down there, right? You want the gas to be able to fuse through that fairly easily. And so that's why you're not going to see stratified squamous epithelium, for instance, down at the exchange surfaces of the lungs, right? Because it'd be harder for that to pass through, the oxygen to move through. So understanding that, you can see there's a nice image of it. You get function, location, and you're good to go. And so this image represents the lining of the peritoneal cavity in terms of a location for that. Next one is stratified squamous. Stratified squamous is multiple layers of flat cells, and the main function here is strictly protection, right? And so our skin is a great example of stratified squamous epithelium. Multiple layers of cells stacked on top of each other, and it's going to provide nice protection, as you can see here, right? You have the basement membrane here, at the free surface up here, and then you have all these cells lining up attached to the connective tissue. And so that's stratified squamous epithelium. Okay? And so that's a pretty straightforward one you guys have seen before, and we'll explore that a little bit further when we do the integumentary system next next lecture after this, which is looking primarily just at the skin. After that, we can look at simple cuboidal, right? Simple one layer of cube-shaped cells. So again, since it's just one layer, probably not going to provide a ton of protection, but nice for secretion and absorption. So oftentimes, simple cuboidal cells are found in glandular structures, ductal passageways, kidneys, those types of locations. And just like it is, right? It's cube-shaped cells, one layer, providing secretion and absorption primarily in terms of the function. So for instance, you'll see this in the kidneys, right, where urine is manufactured, and how not only components, waste products are excreted, but also water is reabsorbed along these kidney tubules. We'll talk about that more in AMP2 when we look at the urinary system. All right. Stratified cuboidal, multiple layers of cube-shaped cells. This is a very rare tissue. You do not need to identify this one in lab, so I just wanted to mention that it is out there, but it's not one that we're going to spend a lot of time on, and so we have that stratified cuboidal, as you can see there. Kind of similar to simple cuboidal, obviously, except typically just maybe 2 or 3 layers of cells in certain ducts, but pretty rare. Transitional epithelium. Transitional, as the term indicates, means it transitions from one shape to another, and that's exactly what happens. The multiple layers of cells are capable of stretching, right? And the term transitional because the appearance changes, right? And so basically it allows expansion and recoil. So for instance, like in our urinary bladder, we have transitional epithelium, and as the bladder is empty, it's more in a recoiled position, and then as urine fills in over time, it expands out and changes shape. And so that's the importance of transitional epithelium. And so these images show that nicely in a recoiled and then expanded position. We'll always be looking at it in a recoiled position under the microscope, so that should be pretty distinctive when you're looking at that in lab. Okay? Simple columnar, again, one layer, but this time of tall, thin, rectangular shaped cells. And this one, even though it's only one layer, will provide protection because the cells are so tall and long, right? Also can do secretion and absorption. And this simple columnar, a great example where simple columnar is found is in our digestive pathway, like the stomach and the intestines, because you need protection down at that area, right, in the digestive pathway, because you got a lot of churning going on and acids and enzymes being released. So you need something fairly tough, but you also need to be able to secrete digestive enzymes and other components, as well as absorb nutrients. So a lot of functionality going on there with this simple columnar epithelium. And you can see, again, long columnar-shaped cells. What's typically very distinctive about simple columnar epithelium is the microvilli. As I mentioned before, it looks sort of like a bar running across the top, or someone took a Sharpie and drew a line across the top. It's kind of what it looks like under the microscope. So, of course, attaches at the base of the membrane to some connective tissue, and that's simple columnar epithelium. Stratified columnar epithelium, again, sort of like stratified cuboidal, pretty rare, not going to see it that much. But I just want to mention it so you knew it was out there as a possibility of a type of tissue. And then finally, we have pseudostratified ciliated columnar epithelium. And this is a situation where all the cells are attached to the basement membrane, but not all of them necessarily reach the free surface. And so a great example of where we have pseudostratified ciliated columnar epithelium is in the nasal cavity and the bronchi and the lungs. And they're going to provide some protection as primary function, but also do some secretion of mucus to help keep that area clean. So as you can see in this image, like for instance, lining of the tracheas, where this image is being shown, you can see the pseudostratified cells that have cilia across the top. Cilia, unlike microvilli in the previous image for simple columnar, looks a lot different. The extensions are more finger-like projections that come out further, as opposed to just looking like sort of a bar across the top. And these cilia actually can beat and move and remove mucus, for instance, and debris, like in our airway in the trachea. So that's pseudostratified ciliated columnar epithelium. All right. Now, what is the benefit of studying some of these cells? Well, perhaps pulling some of these cells from a tissue sample can allow us to check for cancer cells or pathogens or other things like that. And so a great example of that would be the test for cervical cancer, right? It's a Pap test or Pap smear named after the physician who invented the test. So it can be very useful, right? If we know what the cells are supposed to look like or the tissue is supposed to look like under a normal circumstance, take a sample, and if there's any abnormalities there, it can help us perhaps take an action to help, treat or prevent disease from occurring. So that's exfoliative cytology, right? So it's important to understand what these tissues are supposed to be like and what their function is. All right. All right. So that is the tissues of the epithelial from an epithelial standpoint or category. As I said at the outset, we'll also, under the umbrella of epithelial tissues, look at glandular epithelium, because the glandular epithelia all have their roots and connections with the epithelial system, and so we want to take a look at how these work. And before we do that, first thing you need to know is there's actually two types of glands in the body. One glandular structure is what's called an endocrine gland. Endocrine gland, like you should think of with the endocrine system, which we'll do later on in the semester, deals with the releasing of hormones. And these secretions from these endocrine glands are released into the bloodstream primarily, so they stay inside the body, hence the term endocrine gland, right? Whereas the exocrine glands, exo, they produce secretions that are ultimately going to be dumped onto epithelial surface, so they're going outside of the body, right? Endocrine glands releasing hormones are staying inside the body. Exocrine glands are releasing like sweat and other types of secretions onto epithelial surfaces. All right, so that's the big difference there. So endocrine glands, right? Secretions are being released into the blood primarily. These are called hormones. Whereas what we're going to focus on is exocrine glands. Exocrine glands produce their secretions onto an epithelial surface, right? So things like sweat, saliva, tears, etc. These are all examples of exocrine glands, right? And so studying exocrine glands, we can look at them based on many different classifications. One would be mode of secretion, which is basically speaking to the mechanism, like what is the cell doing to produce the secretion and how is it being released. And there are three different modes: merocrine, apocrine, and holocrine. So we'll explore those. That's what we'll look at the most when we're talking about these different exocrine glands. You can also look at the type of secretion, what's being released, and the gland structure. Some are simple, some are more complex, and so we'll look at those briefly as well. All right, so as I said, the thing we want to focus on mostly is the mode of secretion, right? What is happening in terms of how the secretory product is being released. And so we have these three types: merocrine, apocrine, and holocrine. We want to look to figure out define what these are, as well as sort of give an example of each. So you can see merocrine, apocrine, and holocrine. Right? So the first one is merocrine secretion. This is the most common type of exocrine gland you'll find in the body. The secretory products are produced, again, by the Golgi, just like we were talking about previously, in the vesicles that are ultimately released at the free surface via what's called exocytosis, right? So sweat gland, right? These are sort of garden variety sweat glands that help keep us cool throughout the body. This is a great example of a merocrine sweat gland. And so as you can see in this image, the product is released from the secretory vesicle at the apical surface of the gland cell by exocytosis. And so here you can see a nice example of that. The Golgi producing the secretory vesicles, and they're being released at the free surface, right? And so the cell itself is staying intact and is able to continually release this merocrine secretion as needed. All right, so salivary glands, another really good example of that. All right, next one is apocrine secretion. Apocrine, we don't see these quite as much. Great example of apocrine secretion are mammary glands. One is mammary gland, which is nursing, produces milk, and it's released at the free surface in this way. But the significant difference about apocrine is that part of this gland cell, a fragment of the gland cell, is actually shed as part of the secretory process. So you can see the apical portion of the cytoplasm becomes packed with secretory vesicles and then is shed. Right? And so here we see apocrine. Nice example of that is mammary gland. You can see in the apical portion, or the top portion, begins to fill with secretory products. Essentially, it breaks down and is shed as part of that, and the cell itself needs to repair and regrow, and then finally the process starts over. So you can see a good example of that apocrine secretion. Third type is holocrine secretion. And this one is where the entire gland cell becomes packed with secretory products and then bursts. So the gland cells then are replaced by stem cells, and so sebaceous glands associated with hair follicles that sort of lubricate our hair and our skin are great examples of holocrine secretion, right? And this you can see in holocrine secretion, the superficial gland cell becomes packed with these secretory products and is completely shed, right? And so cell division is needed to replace these lost cells, and then they're shed at the free surface. All right, so that is holocrine secretion. So make sure you have a good feel for each of those exocrine glandular methods and modes, and some examples of each. Now, as I said, you can also look at the type of secretion. Is it a serous gland or a mucus gland or a mixture of both? We can also look at gland structure, right? As I said, you have some that are more basic, like unicellular glands, like goblet cells, for instance, are the only unicellular glands found in epithelia, right? We saw those in the digestive pathway and simple columnar epithelium. But mostly what you have are multicellular glands, and multicellular glands, you have many different structures and options in terms of how they're branched and organized, but you don't need to worry about memorizing all of these different gland structures. Just understand you have sort of a variety of those. All right, so that is it for epithelial tissue. So we talked about all the different tissue types, and then we also looked at a little bit about glands. All right, so now we're on to the next tissue type, and that is connective tissue. Connective tissue is different from epithelial tissue, and the primary difference is cells. In epithelial tissues, right, all we were concerned about were cells. We weren't looking at anything else. So with connective tissue, we will be looking at some cells, but we'll also be looking at protein fibers like collagen fibers and elastic fibers, as well as a ground substance or background matrix. So there's three components here with connective tissue that we'll typically see, and we call those cells as well as extracellular components, right? And the extracellular components make up the majority of tissue volume, whereas with epithelia, right, all we saw were cells. That's what we were looking at only, were cells. So we'll be looking at some other features here. So some of the functions of connective tissue, really important, helps establish a structural framework for the body, right, like with your skeletal system or other connective tissues that sort of hold things together. Transporting fluids, your blood is considered to be a connective tissue. Protection of delicate organs like your skull, right, is going to protect your brain. Supporting and interconnecting other types of tissue like tendons, they're going to hold muscles and bones together. Storage of energy reserves, protecting and defending the body from microorganisms. So we have a lot of functions with connective tissue. Now, there are basically three categories or three classifications of connective tissues. We have connective tissue proper, fluid connective tissues, and then supporting connective tissues. And each, as you can see, have a different primary function. Okay? And so we'll go through each of these. We'll focus mostly on connective tissue proper and supporting connective tissues for this lecture. All right, so connective tissue proper, the first category, is designed to connect and protect. And within that connective tissue proper category, we have two examples. We have what's called loose connective tissue and dense connective tissue. Loose connective tissue has fewer fibers, like fewer collagen fibers, whereas dense connective tissue has more fibers and less ground substance. So a good example of each loose connective tissue example would be adipose tissue, right? Whereas tendons would be a nice example for dense connective tissue. In this connective tissue proper category, we're going to see, as I said, nice variety of different types of cells, but we're also going to see fibers and this sort of background matrix or ground substance. All right? So let's briefly take a look at these characteristics and see what they're all about. So, as I said, the first thing you're going to have is a cell population. And connective tissue proper contains quite the varied cell population, from adipocytes and macrophages to lymphocytes, melanocytes, all kinds of cells that we're going to see in connective tissue proper. And so just having a sort of general working knowledge of these different cell types is going to be very beneficial to you as you will be looking at this again throughout this semester and next semester, coming across these different types of cells. So, fibroblasts. Fibroblasts. You should know that the term blast means to produce or form or give life to. And so fibroblasts are very important because they're ultimately going to produce fibers. And as we know, fibers are a significant component of connective tissues. Okay? So they're going to help form these fibers and form what are called fibrocytes, which is the next category, right? The second most abundant cell type, also found in connective tissue, and help maintain the fibers in this connective tissue proper. We'll see adipocytes, which are fat cells. We'll talk a little bit more about those in a minute. We'll see mesenchymal cells, which are stem cells that are great because they have the ability to differentiate into other types of cells as needed. Often at a time of injury or infection, they'll migrate, mesenchymal cells will migrate to the site and can differentiate into fibroblasts or macrophages, again, whatever really is needed at that time. Macrophages are cells of the immune system. Macrophages, sort of the Pac-Man of the immune system, right? They actually have the ability to eat and consume pathogens and damaged cells, and they typically migrate around for the most part throughout the body to wherever they're needed. Mast cells are really important in stimulating inflammation. So you get an injury or infection of some kind. Mast cells are going to release histamine and heparin, which we'll talk about a little bit later in terms of how those cells promote vasodilation and increase blood flow and oxygen to sites. So they can be very important in that process. Lymphocytes are specialized immune cells like T cells, for instance. You may have heard of those. Some may also produce plasma cells that produce antibodies, but basically they're part of our specific defense system that targets and can help remember things that perhaps enter our system. Macrophages are very similar to macrophages, like these are neutrophils and eosinophils, and in MP2 we'll talk all about different types of white blood cells. And then melanocytes. We'll look at melanocytes a little bit more in the integument chapter coming up next because these are really important. They synthesize and produce the brown pigment melanin, right? It's just oftentimes give our skin color and our hair color, but also you'll see some of these melanocytes in connective tissue, all right? Connective tissue proper anyway. So that's one aspect of connective tissue proper, right? You have this varied cell population. In connective tissue proper, you also have fibers, right? Different types of fibers, 3 different types for that matter: collagen, reticular, and elastic fibers. Collagen fibers are probably the most common type of connective tissue or common type of fiber you'll find in connective tissue proper. When you think of collagen fibers, you should think of rope, right? Like really long, straight, strong, unbranched. It has great strength, but also a little bit of flexibility. And so, for example, tendons and ligaments. Things that attach, tendons attach muscle to bone, ligaments attach bone to bone. And these are great examples of things containing collagen fibers. So really strong, rope-like material. Reticular fibers are also strong and flexible, but these are more of a network of fibers as opposed to being very long and straight like we saw with collagen fibers. So these can resist force in many directions and oftentimes form sheaths around organs like at the liver, for instance. And then finally you have elastic fibers, right? Elastic fibers are branched and wavy, and they have the ability to stretch, of course, as the term elastic refers to. Okay, so elasticity is going to be a very important concept we'll talk about a little bit more when we do the integument in our 3rd chapter of this unit. And then finally, so you have varied cell population of these three different types of fibers, and then finally you have a ground substance, sort of a background matrix, clear, somewhat colorless, also has a certain amount of viscosity, which makes it a little sticky and helps slow pathogen movement, and these fill the spaces between cells and protect them that way. All right, so those are your different features and things we're going to see in connective tissue proper. And as I said, there are two types of connective tissue proper, but loose connective and dense connective. Right? So loose connective, we'll look at those first. There are three of those. We have areolar, adipose, and reticular. And these are generally considered sort of the packing materials of the body. And what we mean by packing materials is, think if you were going to send off something fragile to someone in the mail, or a present or something like that, like if it was a glass or a frame or something, you probably just wouldn't throw it in the box and send it off in the mail, right? Probably stuff it in the box, maybe tape it down, maybe put some newspaper in there, some styrofoam chips, other types of things to help protect it and stabilize it. That's what loose connective tissue is, those packing materials of the body. So we'll look at some of those, get a feel for how that works. So the first one, which is very common in the body, is areolar connective tissue. And this is a really important one. It has great functionality because it's the least specialized, right? It has a very open framework, has a very viscous ground substance, holds blood vessels and capillary beds, and this is areolar is what your stratified squamous epithelium, what it's attached to, right? So oftentimes the epithelial tissues are attached to this type of tissue. And it's great because it has a lot of components in it. As you can see, this is an illustration where you have collagen fibers here, right? You have mast cells, you have elastic fibers here, you have reticular fibers, different types of cells. You can see in pink is sort of the background matrix, right? So a lot of stuff going on in this cell, and that gives it strength, but it also gives it flexibility. And you can see what it kind of looks like under the microscope, right? You can see in pink sort of are those collagen fibers, the straight lines, or the elastic fibers. You can see a very different types of cells as well. So a lot of functionality there with areolar. And so areolar, as I said, typically you're going to find this in the dermis, right? It's what your skin attaches to. Okay? And so it can provide support, permit movement, can also provide defense, right? A lot of macrophages and other mast cells, other types of defense cells sort of hang out in this connective tissue and migrate when they're needed to those locations. All right? So that is areolar. Next, under this loose connective, is adipose. Again, adipose tissue has fat cells, right? And fat cells, there's actually two types of adipose tissue, white and brown fat. White fat is what we most commonly have in the body. Stores lipid, also slows heat loss, right? So it does provide some insulation, can be a shock absorber. And so this is what we have, like our subcutaneous, right below the skin fat is this white fat, right? Just very common. Brown fat is a little bit different. It's a little more vascularized. Adipocytes actually have mitochondria. They can absorb energy from these tissue and release energy. So a little bit different. Adipose cells typically do not divide. Oftentimes they just expand or shrink depending on how much lipid is in your system, right? So that's when you're looking at these under the microscope. They were not all the exact same size, right? They're a little bit different. So it depends on that capability. And mesenchymal cells, again, remember those stem cells that can differentiate, can also differentiate and divide to have more fat cells if needed. So there's a nice image of what it looks like under the microscope. You can see functions and locations, and I think you're pretty well versed on that. Last one of these loose connective tissues is reticular tissue. Okay? Provides support, complex three-dimensional network, but again, this tissue is not one you have to identify in the lab, but it's good to know what this one is and sort of what it looks like. You can see the reticular fibers providing that nice supportive framework, like the sheath around your liver tissue, for instance, is made of this reticular tissue. All right, so that's loose connective. What about dense connective? Dense connective tissues are things that have mostly just fibers, right, and not much else. So you have dense regular, dense irregular, and elastic, right? Dense regular is one you want to focus on. It is tightly packed, parallel bundles of collagen fibers. So tendons and ligaments are great examples of dense regular connective tissue, right? Because they attach muscle to bone or bone to bone and provide excellent strength and support, and also some flexibility. And here you can see what it looks like under the microscope, right? You can see these collagen, wavy collagen fibers, right, just right on top of one another, providing a lot of strength. All right? Dense irregular is more layered in skin, right? It's more of a connective tissue, bundles of these collagen fibers. So we don't really see that one quite as much. And then elastic tissue are made of elastic fibers that are going to help support and allow flexibility, like, for instance, in between each of the vertebrae. Not the discs, but the ligaments in between your adjoining vertebrae have this elastic fiber, right? So it gives you some flexibility there. All right? Now, that's your your connective tissue proper, right? Next is fluid connective tissues, and fluid connective tissues are connective tissues that contain cells in a fluid matrix, like blood or lymph. We'll do both blood and lymph in AP2, so now we just want to briefly introduce this so you have just a sort of working understanding of what's going on here. So blood, of course, contains primarily red blood cells, white blood cells, and platelets, whereas lymph fluid contains primarily lymphocytes and is part of the immune system. So there you can see red blood cells, white blood cells, platelets, which help with clotting, and then lymph is, again, a fluid found in these lymphatic vessels that contain lymphocytes and are part of our immune system and our defense. Right? So cardiovascular system pumps blood, lymphatic system holds this lymph fluid. All right, so that's your second category. Again, we'll be looking at that more in AP2. Final category of these connective tissues are supporting connective tissue. And supporting connective tissue supports soft tissues and body weights of things like bone, right, and cartilage. That's what we're going to be looking at here. Okay, and cartilage. There are three types of cartilage: hyaline, elastic cartilage, and fibrocartilage. And these tissue samples explain only type of cell they contain are what are called chondrocytes. Chondrocytes are cartilage cells, right? And then you'll also see sort of a gel-like background matrix where these chondrocytes reside. And some may have more fibers in them than others, okay? So that's generally what you're going to see with cartilage. Cartilage is avascular, important concept. That's avascular term again, right? No blood vessels. And so cartilage prohibits blood vessel formation by producing what's called anti-angiogenesis factor, right? This anti-angiogenesis factor does not allow vessels to form, and as a result, injured cartilage heals very slowly because of a lack of blood supply. So for instance, when, oftentimes someone has like an arthritic knee where there's no fibrocartilage disc, meniscus disc pads in between their knee, there's no way to wait and see if that fibrocartilage comes back. Typically what they do in those scenarios is just do a knee replacement, replace the joint all together, because that fibrocartilage is not really going to come back. So healing is a property that doesn't go very well for these cartilage tissues. So as I said, there are three types: hyaline, elastic, and fibrocartilage. Hyaline cartilage is stiff, found like at synovial joints or in the sternum, for instance, or trachea. And if you look at it under the microscope, it just has a background matrix and chondrocytes. That's pretty much all that you're going to see in these locations of hyaline cartilage. Elastic cartilage, similar thing. Great example where we find elastic cartilage is in your ear, right? Your outer ear, right? You can just bend that and pop right back into place. That is elastic cartilage, and this again has chondrocytes in the matrix. But also, what we're seeing here that's a little bit different is that you're seeing fibers, elastic fibers in the matrix as well. So you have the cells and you have the matrix, but you also have fibers. Where we didn't see, fibers are present, but we didn't see them as well in hyaline cartilage. Last one, fibrocartilage. This is made up of fibrous collagen fibers that provide excellent cushioning and prevent bone-to-bone contact. So like in your knee joints, a great example of the intervertebral discs, right, in between each of your vertebrae. Those discs are made of primarily fibrocartilage as well. And so here you can see collagen fibers in the matrix, right, but you can also see the chondrocytes, right? So those are great examples of where you find fibrocartilage. All right, so those are your three types of cartilage. And then the last supporting connective tissue is bone. Bone, we will be spending a whole chapter looking at bone and the skeletal system coming up. So just briefly have an understanding of what bone is, right? It's very strong and resists shattering, of course. Has a appearance and almost looks kind of like a tree stump, right? As you have these these central canals in the middle and these layers of bone matrix laid down sort of in this concentric pattern. And so it's very typical of what you see with an osteon, right? And so that one's pretty distinctive. But again, we'll spend a lot of time working on that coming up when we do a whole chapter on the skeletal system. All right? All right, so that takes us to membranes. Membranes are components of, or physical barriers, that contain components of both the epithelial system and the connective tissue system, right? Or not system, tissues, and so membranes are physical barriers. So if you have an epithelial tissue attached to a connective tissue, collectively, that is what we call a membrane, right? And so there are many different types of membranes in the body. We have mucous, serous, cutaneous, synovial membrane, and we'll take a look at these different types. But again, they're made of things we've already studied. It's an epithelial component and a connective component. When they come together, then we call it collectively a membrane. All right? So mucous membrane, really important membrane that's lining our digestive pathway, respiratory, urinary, reproductive tracts, and contains an epithelial component, right, which typically releases a mucus secretion to keep that surface moist, like in the digestive pathway, for instance, right? You want those digestive pathways to be moist, right, so that materials can move through and digestion can continue on without issue. And that epithelial component is attached to a connective tissue we call lamina propria, or made of areolar connective, right? And so if you look at the slide, it'll look familiar, right? Has an epithelial component attached to a connective tissue component. Collectively, we call that a mucous membrane. You can see there's a goblet cell right there producing mucus, and mucus is a nice secretion under the upper surface and keeps that surface moist, right? Now, in colon cancer, which is a type of cancer you've probably heard of, the part that becomes cancerous is this mucous membrane, right? This mucous membrane, these epithelial cells that are supposed to keep this pathway moist and lined, the cells, for whatever reason, they start to divide out of control. So that's sort of the hallmark of cancer, is that they're abnormal cells that are not dying off. They're continuing to divide at a faster rate than normal tissue, and basically they overtake and invade where normal tissue is supposed to be. And so oftentimes the danger with things like colon cancer is not only obviously that you have cancer in the colon, but the fact that it can potentially spread or metastasize to other locations. And oftentimes that metastasis occurs through what's called the lymphatic system, right? You have all these lymphatic vessels that go very deep and close in the connective tissue, almost all the way to the mucosa. And so as those cells, for instance, are getting cancerous, right, they can invade into the lymphatic system and metastasize in that fashion. So very important that oftentimes when someone, like for instance, has colon cancer, they'll probably do a surgery to remove the cancerous tissue, but oftentimes they'll also do what's called a lymph node resection to remove lymph nodes in that area to help prevent the potential of spreading of the cancer either at that time or later if it comes back. So So anyway, so that's colon cancer. It's found as part of this mucous membrane. All right, so mucous membrane is one type. Another type is a serous membrane, and we've talked about this already. These are the thin layer of cells that line cavities that are inside our body. Like, for instance, we have, these thoracic cavity, right? We talked about these body cavities having a layer lining the cavity itself, but also lining the organ itself, right? The parietal portion covers the cavity, the visceral portion covers the organ. And oftentimes these have a transudate, which is a fluid, on their surface to help reduce friction. So when these two membranes rub together, things can move very easily. Okay? So those are serous membrane. Right? There are three types: pleural, peritoneal, and pericardial. Serous membranes, right? They have a lining that covers the cavity, but also covers the organ. Okay? Like, for instance, pericardium. Right? We have a lining covering the pericardial cavity, but also a separate lining covering the heart. And here's what that looks like. Right? You have a simple squamous epithelium attached to areolar connective tissue, and these serous membranes are going to line all of these different ventral body cavities. All right? You have cutaneous membrane. It's a third type of membrane, and the cutaneous membrane is found at the skin's surface, right? That's basically what your skin is called. Another name for it is the cutaneous membrane, right? And so it's multiple layers of flat-shaped cells stacked on top of one another, attached to an areolar connective tissue, right? So collectively, we call that cutaneous membrane. And then finally, the last type, which we'll look at a little bit more when we do articulations later in the semester, are what's called synovial membranes. Synovial membranes are membranes that line joint cavities, right? So like at your knee, for instance, right? You have the two bones coming together, the tibia and the femur primarily, and it's lined with this synovial membrane. The synovial membrane has the ability to produce what's called synovial fluid. Synovial fluid is a lubricant that can be released into the joint, keep that joint moving, very easily. Right? So that's the synovial membrane. And like I said, we'll look at that a little bit further when we do articulations later in the semester. All right, so back to our discussion on tissues. And there are just two more types of tissues that we have to go over. We have muscle and nervous, right? And so we've seen these before already in lab. Muscle tissues contract, right? They all do. There's three different types: skeletal, cardiac, and smooth. But they all are found in different locations and all work a little bit differently, right? Now, there's a way you can classify and sort of try to think about muscle tissue, and that is based, number one, on whether or not it is striated. Striated or non-striated. And striated means it has a banded or striped appearance because of how the proteins are organized in such a consistent fashion that they're banded and gives them that striped appearance. Skeletal and cardiac muscle are striated. Smooth muscle is not striated. You do not see the stripes. So that's one way to help you distinguish between them, is whether or not they're striated. Right? Another is that muscle cells have a single nucleus or multinucleate. And then finally, this really isn't a visual, but voluntary or involuntary. Do the cells control consciously, or do they work automatically? Okay? And so you can take that, all those features, and sort of apply them to each of these cells and see what you get. So skeletal muscle is voluntary, of course, produces skeletal movement when it contracts, and has striations and is multinucleate, as you can see in these images. So very consistent tissue, highly organized, banded in terms of its appearance. And, again, it contracts to cause skeletal movement. It can also produce heat, store nutrients, things like that, but from appearance, that's what it's going to look like. Cardiac muscle cells are involuntary, of course, right? You're not in charge of or dictating when the muscle is going to contract, right? These cardiac muscle cells are found only in the heart. They have striations, but they're not quite as consistent as we see with skeletal muscle, right? So you can see the stripes or striations, but you're not really going to see quite as highly organized. A little more branched, and also you're going to see what are called intercalated discs, which are sections of discs that sort of connect adjacent components of cardiac muscle tissue. And then finally, you have smooth muscle tissue. Smooth muscle tissue is involuntary also, and this is found in many different locations in the body. They surround blood vessels to control vasodilation or vasoconstriction. See them in the smooth muscle in the urinary bladder, in the respiratory passageways, constriction or dilation as well. So a lot of locations for smooth muscle. Smooth muscle is very different from the other two. It has no striations. It has a single nucleus for each cell. So pretty distinctive in terms of that one. All right, so you can see locations and functions, smooth muscle. You have a good grasp on that. Finally, the last tissue type is nervous tissue. Right, nervous tissue. There are two types of cells within nervous tissue, either the neuron, or what are called neuroglia or glial cells. We'll focus right now, for the most part, on neurons, and that's what you're looking at in the microscope and lab. And neurons are specialized cells that generate and conduct electrical impulses or action potentials. Right? These move and basically process information, and obviously nervous tissue is found in the brain and the spinal cord, and out in peripheral nerves. Okay, so those are neurons. And as I said, you have this other classification of cells in the nervous tissue. You have glial cells, or neuroglia. And glial cells are basically supporting cells. They do not generate electrical impulses or action potential, but basically support neurons so they can create an environment where the neurons can work and thrive and generate their impulses. And so you've seen in the lab what a neuron really looks like. It has, as you can see in this image, and here's kind of what it looks like under the microscope, has this cell body with a nucleus, perhaps some dendrites extending off of it, but oftentimes also it has an axon, which is basically like a long cord that conducts the action potential to wherever the target is trying to communicate with. Neuroglia, again, are just cells that maintain the environment for the neuron, right? So they can maintain the physical structure, repair tissue, perform phagocytosis, nutrients, provide nutrients, etc. So a lot of functionality there with glial cells. And we'll look at glial cells more when we do the nervous tissue chapter later on in the semester. All right, so this is what it looks like under the microscope. These are glial cells and a neuron. Now, these last two components, looking at tissue injuring and aging, spend time with this. You have the two processes basically are inflammation and regeneration is how tissues respond to a given injury. And you want to run through this, make sure you have a good understanding of what's happening with inflammation. I think it's pretty straightforward. I'm not going to spend a whole lot of time going over it. But there's a nice slide here at the end that sort of gives you a nice visual of what happens in the process. Make sure you have a good understanding of this process, right? Where when you have an initial injury or inflammation or something that's occurring, we see mast cells being activated. That causes inflammation and increased blood flow and pain, and then finally increased temperature at that site. Oxygen and nutrients will increase, and then we begin, once inflammation starts to subside, we start to see regeneration. And oftentimes regeneration is a result of fibroblasts laying down fibers and other areas that are being remodeled over time, which can result in scar tissue. We'll make sure you have a good understanding of that. And we'll look at aging at the end of most of these chapters. Just review aging in tissues, what happens with the tissues as you go through this. Bottom line with aging in tissues is that cells and fibers that are produced and manufactured, we don't produce as many of those as we get older. Metabolism drops across the board, we see changes in hormones, and so as a result, you lose speed and efficiency of tissue repair as we get older because you're not producing the cells to replace and repair those cells with as efficiently. Okay? So make sure you look at that. Some of the effects that we're going to see with aging or thinning epithelia and joint pain, bone brittleness, cardiovascular, mental deterioration. These are all components that are going to be happening with the aging process. So make sure to review those and have a good understanding of what we're seeing with aging. Cancer is also going to increase as we get older. A lot of this has to do with our immune system. Our immune system is not as effective as we age. It diminishes effectiveness as we age, and we'll look at that a little bit more when we talk about immunity and ANP2. All right? So that is it on the histology chapter. And after this, we'll do the integument chapter, which is, as I said, primarily the skin. Get that posted and up, and then you'll be ready for your first exam on those first 3 chapters. All right?